So continuing to the protective equipment, a protective equipment has been designed to shield the various parts of the body against injury without interfering with sporting activity. Protective equipment can also be used on a return to activity after injury in situations where direct contact may aggravate the injury. Helmets are mandatory in the certain sports such as motor racing, motorcycling, cycling, ice hockey, horse riding, and American football. Here you can see the helmet which are used in American football. Moving on. In other sport, the use of the helmet is not universally accepted, such as in rugby, football, and skateboarding. The role of helmets and face shield is the protection against the head injury or concussion. The other protective equipment commonly worn includes mouth guard in most collision sports such as hockey, shoulder pads in American and rugby football, chest, forearm and groin protectors in the ice hockey, knee pads when playing on artificial surface or while rollerblading, wrist guard in the rollerblading, and snowboarding and shin pads in soccer and hockey. It is important that the protective equipment fits correctly. The protective equipment may provide a psychological benefit by increasing a player's confidence. Suitable equipment. Running shoes, football boots, ski boots, and tennis rackets are important elements that contribute to or prevent sports injuries. Running shoes. The sports clinician must be able to assess for foot type adhesive athlete on the type of shoe must be suited to their needs. The optimum shoe for a runner is one that matches the shoe runner's specific mechanical features. Several features of shoe may affect foot function. The first part of the shoe to be considered is the heel counter, the upper rear part of the shoe. The heel counter should be made up of rigid, firm plastic to assist in rear foot stability. Here are the part of the shoe. As you can see, there is a no outsole, the heel counter, the heel collar, the toe box, the forequarter, the shank, the midsole. Forefoot flexibility must be adequate to allow easy motion of the foot, flexing a toe off. With a rigid sole, the calf muscles may need to perform extra work in order to plant or flex the foot during propulsion. A shoe with a lack of flexibility in the forefoot may help the individual with a metatarsalgia. The midsole of the shoe is probably the most important features. The midsoles are usually made up of EVA, which is light and a good shock absorber. The midsole houses a more complex shock absorbing material such as gel pad and air bladders. The most important feature of the midsole is its density, the durometer. It should be appropriately firm or soft depending on the mechanism and the weight of the individual. Midsoles are that are too soft permit excessive mobility, whereas firmer ones allow a more stable platform and often extended wear. Runners requiring control of excessive motion should use a midsole of dual density that is harder on the medial aspect of the foot. The runners requiring extra shock absorption should choose a shoe with a soft midsole that still provides lateral stability. Maximum impact forces vary little in magnitude between a soft and hard midsole, but the maximal forces occur at a larger stage in the soft shoes. The midsole that are applied promote rapid and excessive pronation of the foot and should be avoided. This negative aspect of the lateral flaring outweighs the advantage of decreased impact forces. Last construction referred to the method used to join the upper and the shoe to the midsole. Shoes are generally slip lasted, where the upper is sewn together and glued directly to the sole. This promotes shoe flexibility but may reduce stability. Stable lasting is a technique where canvas or foam is permitted, stitched to the base of the upper and the glued to the midsole. This lasting technique can become a popular when manufacturers replace the fiber board with rigid plates lodged directly in the midsole to increase torsional rigidity. The last construction, once the primary feature in footwear design, is now seen as a primary factor influencing the fit of the shoe, but it has been little influence on the mechanics and foot function. There is no evidence to support the commonly held view that the shape of a shoe influences foot function. There is a range of large shapes available in today's shoe market. It is important that athlete is fitted by a professional and is comfortable with the feel of the running shoe before they are purchased. The footwear modification, the footwear brand is differ in the construction. You can see the characteristic of a running shoe. It should be flexible. It should have a 4-foot flexibility. The midsole dual density, medial side of the midsole, harder than the lateral side. This promotes the stability. There's a part between the upper and outsole, the midsole. The last shape, shoe on the left is straight, while shoe on the right is curved. The running spikes, poorly designed running spikes may contribute to foot and lower limb injuries, but there is a dearth of published literature in this field. The majority, as you can see, majority of running spikes are designed so that the spike plate is plantigrade in relation to the heel. When running on a flat surface, the heel lift is negligible and thus the heel is lower than the forefoot, which we call negative heel. This phenomena is opposite of heel raises are used in the treatment of Achilles problems. Here, as you can see, there is a running spike. When running in spikes, the athlete strikes the ground on the forefoot and midfoot with the heel of the ground. The heel does not usually make contact with the ground while running at or near the top speed. However, at lesser speeds, as the body weight moves over the foot lowers the ground with the little stability due to negative heel. The calf muscles may be subject to greater eccentric load due to the negative heel lift, as the tibia is required to dorsiflex over the foot through the great range of motion. In addition, the small heel provides a little stability for the eccentric lowering of the heel by the calf muscles. These factors may predispose to the development of Achilles tendinopathy and shin pain in runners, as well as increasing the amount of compensatory pronation and metatarsal joint dorsiflexion. Running spikes may be modified to provide more stability by increasing the heel lift and balancing the shoe. Here are the shoe features appropriate for different foot types. Heel counter have excessive pronator, which is rigid. Normal, it is also rigid. Excessive supinator, it's rigid. In forefoot flexibility, it is present. Normal range, it is present. In excessive supinator, present. Midsole density also have hardware density, intermediate, and soft. Here are the shape of last, straight or slightly curved, normally slightly curved, or excessive supinator, curved or slightly. Here are the football boots. Football boots require all the features of good running shoe, in addition to features that will allow kicking and rapid changes of direction, particularly on the soft surfaces. The construction of many types of football boots provides inadequate support for the lower limb. As you can see, problem associated with certain structural features of the football boots. It can cause a decreased rear foot support. A narrow heel counter support can cause heel irritation. A reinforced rigid heel counter can cause heel friction that will immediately cause irritation. Outsole in two pieces causes decreased midfoot stability. A narrow sole can decrease the stability and skin lesion as blisters or pressure sores. A curved shape can cause decreased stability or poor fit. A rigid sole called decreased forefoot flexibility. A shallow upper can cause decreased stability or poor fit. A stock cleat replacement can cause and often at a point of foot flexibility sometimes causes pain under the metatarsophalangeal joint. As you can see, the problem associated with certain structural features of football shoes. The ideal football boot should be of adequate foot depth in the upper, have a rigid heel counter, have a sufficient forefoot flexibility, and have a wide sole that can be slightly curved in a shape, and the stops or cleats should be placed to allow adequate forefoot flexibility. As you can see, the football boots with cleats, the midsole cushion boots with a narrow toe box, thermoplastic outsole with cleat designed to enhance the rotation. Now we're moving on to the ski boots. Generally, ski boots are stiffer. However, a ski boot does not allow adequate compensatory. Is it also same as the football boot? Just major differences are it doesn't allow adequate compensatory movement. It is more advanced gear, requires stiff boots, tightens the ankle. Individually fitted and boots are available that allow individual molding shape of the skier's foot. As you can see, the skier's boot. During skiing, control is maintained by pointing the foot edge down downhill skiing into the slope. Skiers who have to certain biomechanical abnormalities, example forefoot pares, rear foot pares, already have their foot fully pronated in a flat position in the boot. This forces the skiers to internally rotate the lower limb and adopt the valgus knee position to maintain edge control. This may lead to inefficient skiing, fatigue, and medial knee pain. Excessive foot pronation may be corrected with an orthosis placed in the ski boot to restore to the foot to the neutral position. As the degree of correction possible with orthosis is limited by boot fit. Additional control is sometimes required by the use of canting or wedging of the underside of the boot. The most equipment-related skiing injuries occur when the ski acts as a lever to return to or twist the lower leg, and many can be prevented with appropriate binding release. Beginners are particularly at risk as they have relatively tighter bindings and boots and binding of lower quality than intermediate level skiing. The tennis rackets. In tennis, the impact between ball and racket produces a significant amount of force, and how much force reaches the tennis player's arm depends upon how hard the player swings. The speed of incoming ball where on the racket face the ball is struck, the qualities of the racket, the string tension, and the stroke mechanics is very important. Each racket has an area where the initial shock is at a minimal. The center of percussion or sweet spot when the ball is hit in the sweet spot. The shot feels good. If the ball is not hit in the sweet spot, there is an increased shock transmitted to the hand, wrist, and the elbow, which will further cause injury to the lateral or medial side of the elbow. As in tennis racket, this is the sweet spot. The upper one is the dead spot. The racket center of mass, as you can see, we get more bounce from the lower end and the grip. The major factor in the etiology of the tennis-related elbow pain is incorrect stroking technique, especially the backhand drive. However, the characteristic of the racket may also contribute. The older style wooden rackets were heavy and flexible, both of which reduce shock on impact. The modern wide body rackets are lighter and stiffer in order to generate increased power, but these rackets do not absorb the shock of impact as well as the wooden rackets. As you can see, the forehand technique in tennis, and that's the backhand, which involves most of the extensor carporadialis brevis muscles. There are a number of ways of altering the tennis racket to reduce the shock at impact and lessen the force transmitted to the player's arm. Lower the string tension, increase flexibility of the racket, increase the size of racket head, increase the weight, increase the grip size, grip higher on the handle of the racket. The tennis player should choose the largest comfortable grip size. A larger grip size prevents the player gripping the racket too tightly. A player should also be encouraged to loosen their grip on the racket. It is only necessary to squeeze firmly on the grip during the acceleration phase of the stroke. Is a grip size optimal racket grip? Circumference should be equal to the distance of the proximal palm crease to the tip of the finger. Next, moving on to the appropriate surface. The surface on which the sports people play is under the spotlight, as it may be a major contributor to injury risk through excessive shoe surface traction or friction. This possibility was proposed as a mechanism for anterior cruciate ligament and ACL rupture in European handball as early as 1990s, and has later been examined in a large meteorological study where the ACL injury rate was compared between two different floor types: wooden floors, parquet, generally having lower friction, and artificial floor, generally having higher friction. These results indicate that the risk of ACL injury among female team handball players is higher on high friction artificial floors than on the wooden floors. However, other factors also have a significant role in shoe surface friction principle, shoe type and floor maintenance as well. The perennial ryegrass is associated with lower shoe surface traction than Kentucky bluegrass or Bermuda grass because it creates less traction. The studies suggest that ryegrass generally offers a safer surface with respect to ACL injury for football than some other grasses. There are the four different types of grasses that provide surface for Australian rules football and have been associated with different ACL injury. First is the Bermuda couch grass surface, showing a thick thatch layer between grass level and soil. Then there is Kaiku grass, also showing a thick thatch layer. Then there is the ryegrass surface, showing a minimal thatch layer. This is probably a safer surface than the others, as the blade or cleats or the football boots are likely to be gripped by the surface. Then D, it has annual bluegrass, showing a moderate thatch layer. To prevent all possible injuries, it is important to consider playing surface hardness because of its association with overuse injuries such as stress fracture, shin pain, tendinopathy, etc. A hard surface such as concrete generates greater force through the musculoskeletal system than a forgiving surface such as grass. The sporting activities can generate extremely high loads that or may not be modulated by the surface. The maximal impact forces during walking have been shown to approach twice of the body weight. During running, 3 to 4 times, and during jumping, 5 to 12 times. And appropriate training. It is essential for sports clinician to understand the different element of the training and their possible relationship to injury. This familiarity facilitates clinician obtaining a full training history from an injured athlete, or learning about the longer term training strategy from a coach. This makes it possible to determine where the training error occurred and takes active steps to prevent this recurring. The principle of trainings. Training is a pursuit of activity that will ultimately lead to an increase in performance in a given sport. A number of general principles of training apply to all sport: periodization, specificity, overload, and individuality. Now we're going to look forward to the periodization. It has three distinct phases. The conditioning is the preparation, emphasizes developing an aerobic and anaerobic fitness, strength, and power. The athlete is training tired and, if required to complete, would probably perform poorly. Second, the pre-competition, transitional, emphasize switches from pure conditioning to technique work. Next up, the competition. It emphasizes on competitive performance while maintaining the basic conditioning. Moving on, in many sports, for example, basketball, football, and hockey, 4 to 6 month competition season is usual. In some instances, an athlete is required to undertake two periods of competition in the 1 year. In other instances, the competition period may last as long as 8 to 10 months, and conditioning work must extend into the competitive season. However, the same principle of training apply. The athlete should aim for a peak performance at a predetermined time in a competitive season, such as specific championship or final. To ensure complete recovery from the physical and mental stress of competition, adequate time should be allowed between the end of the one season and start of the next. This period may last from 4 to 6 weeks. In the intermediate time frame, it is important to introduce easy weeks into the training program. These give the athlete time to recover and diminish the risk of the injury. During the easy weeks, the volume and intensity of training may be decreased and the opportunity may be taken to the test. The athletes progress in the form of time trial, mini competition, or practice match. The optimal spacing of these easy weeks is probably every third or fourth week. Here's a periodization of training. Give a rest of in the month of September, then October, November, 3 months of conditioning phase, the preparation phase, then it's Jan, Feb, and March, 4 months of pre-composition competition, then moving on to 6 month of the competition phase. A team sport, example basketball with a 5 to 6 month season, conditioning in 5 months, pre-competition in 3 months, competition in 2 months, the pre-composition, the transitional month in the 3 months, the competition of 2 months, and the active rest for a month. Here is an 18-month program for an athlete who wishes to peak twice in that period. As you can see, the periodization of training. The overload. Overload is a variable that athletes and coaches manipulate to allow the athlete to perform work at a greater intensity or to perform a greater volume of work at a given intensity or to decrease recovery time between efforts of given volume and intensity. The overload principle includes the following. Apply stress to the body over and over above that which is normally encountered. If increased stress is not excessive and adequate, adaptation time is allowed. The work capacity of athlete will be increased, also known as supercompensation. We allow an adequate recovery time to produce a training effect. Increase training load by changing the volume, quantity, or duration, or the intensity, the quality of training. Only increase volume or intensity at any particular time. Increase in the volume should precede increase in the intensity. The progress of new training activities slowly so as not to cause injury to muscle groups and joints unaccustomed to that activity. The titrate overload to maximally improve performance without incurring injury. This is an art. Monitor the athlete closely for sign of decreased performance or overtraining. Next up, the specificity. Specificity refers to the principle of directing training to performance in an athlete's given sport. It is important, therefore, to identify the most important components of fitness for each particular sport and tailor the athlete's training towards improving these particular components. There is no advantage for a power athlete in doing large amount of endurance training and nor for an endurance athlete to spend considerable time on strength training. Some sports, for example football, require both strength and endurance training. The individuality as individual differences between athlete or great training must be tailored to the individual's need. Individuals differ in their tolerance of the particular training loads, response to specific training stimuli, speed of recovery, physiological, psychological makeup, nutritional intake, and lifestyle habit. Individual responses to training are influenced by previous training history, age, current state of fitness, and genetic makeup. The training methods are endurance and aerobic training, anaerobic training, strength and power training, flexibility training, speed and agility training, specific skill training, and the cross training. Here we'll have a look on the various training methods briefly. First is the aerobic training. The aerobic training is performed to increase the capacity of fitness. The aerobic capacity of an individual is the ability to utilize the body's glycogen stores via the aerobic metabolic pathway. An individual's aerobic capacity is measured by the maximum oxygen consumption, better known as the VO2 max. The maximum amount of oxygen an individual is able to utilize in 1 per minute kilogram of the body weight. Next up, this can be measured in the laboratory by exercising the individual to exhaustion and directly measuring the amount of oxygen consumed and carbon dioxide produced. The accurate method. The predicted VO2 max, simpler but less exact method, is estimated by measuring the heart rate at specific workload and commonly performed in health and fitness centers. Alternatively, the rating of perceived exertion RPE can also be measured at a series of submaximal workloads so that maximal workload predicted to occur at a maximal rate of perceived exertion of 20 units can be estimated. Although the athlete is unable to monitor oxygen consumption directly during training, he or she can monitor heart rate or RPE or both, which correlates well with oxygen consumption during some maximal activity. Thus, heart rate or RPE can be used to monitor the intensity of aerobic training. In muscle, aerobic activity increases mitochondrial number and activity, glycogen storage ability to use free fatty acid, and vascularity. Cardiovascular effects include decreased heart rate and blood pressure with an increased cardiac stroke volume and improved endothelial function. As a guide to the aerobic training effects occur while maintaining an heart rate of between 70% and 85% of the maximum heart rate. The maximum heart rate is estimated by subtracting the age of the athlete from 220. Example, a 30-year-old athlete has a maximum heart rate of approximately 190, then 220 minus the age of the athlete. The ideal range of heart rate for a 30-year-old to gain anaerobic effect would therefore be between 135 to 160 beats per minute. The anaerobic training. Anaerobic exercises utilizes the anaerobic oxygen independent, therefore without the need of oxygen, metabolism of glucose to produce energy. This pathway utilizes ATP as its energy substrate and as a result of produces less energy per molecule of glucose, utilized than that of aerobic exercise. Anaerobic training improves the capacity to maintain a high rate of power production for short durations of exercise at a very high intensity. This requires that muscle requirement and muscle contractile function be better maintained after training so that the onset of fatigue is developed. This may result in apart from the increased efficiency of the body's anaerobic metabolism, while also improving its tolerance of lactic acidosis. The level of discomfort experienced in training correlates well the measured serum lactate concentrations. The most effective method of increasing anaerobic fitness is to undertake a form of intermittent exercise or interval training. Interval training involves a number of bouts of exercise that are separated by periods of rest or recovery. The principle of such training is to achieve a level of lactic acidosis with one individual effort and then allow the body to recover from its effect before embarking on another bout of exercise. There is a scope of enormous variation in the intensity and duration of this exercise bout and the duration of the recovery period. Strength and power training. Moving on, the muscle strength is the amount of the force that may be exerted by an individual in a single maximum muscle contraction. Power is the maximum amount of work an individual can perform in a given unit of time. The muscular strength may be increased by utilizing one of three different resistance training techniques. The isotonic strength training, concentric and eccentric muscle, contraction of combined movement, the isokinetic strength training, the isometric strength training. Moving on to the isotonic strength training. The resistance can be provided by free weights, rubber bands, pulleys, weight machines, or the individual's own body weight. Example includes the bench press, the dumbbell curl, the power squat, and the calf raises. The advantages of isotonic weight training over isometric and isokinetic technique include tend to be more functional, Natural movement. Athlete can observe the work being done as the weight is lifted, may be performed over a full range of movement, or alternatively, over a specific limited range of motion. The athlete coach can measure the amount of weight lifted and the number of repetitions performed. The potential dangers for isotonic weight training include athlete require adequate supervision in the gymnast. The athlete should never attempt to lift a maximal weight without a spotter, an assistant who is able to help the athlete if problem arises. The isotonic machines, such as universal or knotless machines, may provide a safe alternative to the free weights, but these machines limit the range of motion and are unable to provide true constant resistance throughout the lift. The isotonic exercise in which the body weight of the individual is used as a resistance are also safer than free weights and are often more convenient to perform. Exercise such as sit-ups, push-ups, chin-ups can be done almost anywhere and require no supervision. However, it is difficult to increase the resistance of the exercise, and the only way to increase the effort is to increase the number of repetitions performed. The isokinetic and isometric strength training. Because of the need of the specialized equipment, the use of isokinetic training by athletes is usually limited to rehabilitation from injury. The isometric training is usually discouraged because it is developed strength in a very small range of motion. But it is used in rehabilitation after injury where range of motion may be restricted. The Olympic type weightlifting. It is often used as a part of strength training program. It involves the lifting of weight from the floor to a position above the ground. The Olympic type lifts are the power clean, snatch, and clean and jerk. As you can see, mechanics of a weightlifter as a female athlete who thrusts her knees when she attempts a snatch. Weights can be increased by little as 2.5 kilo each time. The belt for the support to the lower back, stomach. Shoes are solid arches and heel. Chalk helps with the grip. The bar, hook grip, finger lock to the thumb in the bar. The bar length is up to 20 kg. For females, it is 15 kg. And for the male, it is a 20 kg. Here, the snatch. How to do a snatch? We lift from the floor to above the head in the movement in an upright position. How we do a clean jerk? One lift from the floor onto the shoulders, then raise the bar above the head by doing a jerk. Here's a lifting area. And here are the referees to see if the lift is properly or not. So, yeah. These lifts are exercise are a great number of muscle groups than conventional weightlifting, exercising them both concentrically and eccentrically. The potential for injury is high, and athletes must learn correct lifting technique before attempting the large weights. It is advisable to wear a weight belt to prevent back injuries because of the explosive nature of the lift. Olympic type lifting is an excellent means of improving power as well as strength. The plyometric training. The use of natural elastic recoil element of human muscle and the neurological stretch reflex to produce a stronger, faster muscle response. A form of resistance training that combines a rapid eccentric muscle contraction followed by a rapid concentric contraction to produce a fast, forceful movement. It must be performed in conjunction with a resistance training program as athletes need to have a minimum basic strength level before commencing plyometry. The example of plyometric activities is the hopping, bounding drills, jump over hurdles. As you can see, jump into over and form of 35 centimeter benches, hopping, stepping, jumping, heavy medicine ball throw, alternate leg bounding, reactive drop jumps, landing, speed hops, etc. The great potential for injury because of explosive nature of plyometrics, delayed onset of muscle soreness, DOMS may occur following these exercises. Plyometrics training should only be performed 1 to 2 times per week. And when athlete is fresh, the surface must be firm but forgiving, such as sprung basketball floors. Injury risk is minimized. If the athlete warm ups and warm down correctly and the volume of work is built up gradually. When the technique begins to deteriorate, the exercise should be stopped. Coming on to the speed training. The running speed, a largely inherited ability, is an important component of many sport athletes can, however, develop speed by improving muscular power and strength, thus increasing stride length and cadence, as well as by improving technique, which increases the efficiency of ground coverage. Therefore, running speed can be increased by undertaking resistance and power training as well as by performing running drills. These drills may include high knees, heel to buttock, and overspeed work, for example, downhill running. The agility training and a rapid reflex are also inherited characteristics. However, like speed, they can be improved somewhat by training and thus are included in training programs of all sports. There is an increasing emphasis on agility training for exercise prescription among seniors to prevent fall. Example of specificity, agility exercise include the classic military stepping exercise and a figure of eight running. These exercises should be sport specific wherever possible. Now the specific skill training. Sport have a specific skill that require training in order to achieve a high level of efficiency. The proportion of training time must be devoted to developing these specific skill, preferably with the aid of a coach. Often skill training requires the repetition of explosive movement and therefore has a high risk of injury. To prevent injury, a proportion of skill training should be done at an high intensity level below normal competition condition. The cross training. To prevent injury, it may be beneficial to reduce the amount of weight bearing exercise. Cross training enables the athlete to maintain aerobic fitness while reducing stress on a weight bearing joints, muscles, and tendons. In athletes with a chronic condition such as articular cartilage damage to weight bearing joints, cross training may be used to reduce the impact load while maintaining adequate training volume. Similarly, in a patient returning to sport from an overuse injury, such as stress fracture, cross training can reduce the risk of recurrence. The runners may wish to introduce 1 to 2 sessions per week of activities such as cycling, swimming, water running. These alternative workouts can mirror the athlete's usual training session. Moving on to the psychology and injury prevention. Excessive psychological arousal can not only impair sporting performance but is also likely to increase the risk of injury. Over-arousal is associated with impairment of natural technique, which players describe as a loss of rhythm. Loss of concentration can also predispose to injury by giving the athlete less time to react to cures. This is clearly a risk in contact with collision sport, but can also cause an injury in non-contact sport. For example, an over-aroused tennis player who does not react optimally to opponent's serve will then be forced to return from a biomechanically poor position, which increases stress on certain muscle groups. Under-arousal can also predispose to injury. For example, if a player has been relegated to a lower level of competition, he or she may not form up as diligently as normal. Furthermore, visual cures may not cause a rapid response as when truly focused. This may lead to injury in body contact sport or technical errors that can lead to fall in sports such as gymnastics. The nutrient and injury prevention. Inadequate nutrient may increase the risk of injury due to its effect of recovery. Inadequate glycogen repletion cause a reliance on a fat and protein store, and this may result in increased protein breakdown, which turn lead to soft tissue injury. There are several mechanisms by which inadequate dietary protein intake may lead to muscle injury. Intense training causes skeletal muscle breakdown injury. Intense training which can be exacerbated by inadequate dietary protein. Moving on to the inadequate hydration may compromises the blood flow to the working muscle, which may increase susceptibility to injury. Hydration is thought to influence the amount of composition of joint fluid, which helps to nourishing articular cartilage. The calcium is a major mineral component of bone, but inadequate dietary intake does not appear to be directly associated with bony injury, such as stress fracture, because of the role of micronutrients in bony and muscle metabolism. Deficiency in nutrients such as potassium, iron, zinc, magnesium, chromium, copper, various vitamins may increase susceptibility to injury. Maintaining low weight and low body fat is important in many sports and it confers an advantage in sports such as running, gymnastics, and sports such as rowing, wrestling. Weight limited are set. Athletes may have a rapid, large fluctuation in weight immediately prior to competition, which is associated with significant losses in lean body tissue and body. So, this is all it about the prevention in sports. Thank you for joining us.